Hello, Sonoma County. Dr. Tom back from San Diego, and I was attending the California Academy of Cosmetic Surgery meeting, the 26th annual, and I was very honored to be invited down there to speak. It was wonderful. I know a lot of people have inquired. Thank you for asking. San Diego is a beautiful city. Of course, I am just a little bit biased towards Northern California, Sonoma County, Napa County. We live in a wonderful, beautiful area, love the people. But if I had to move somewhere else, I think San Diego might be the place that I would move to. And so I was fortunate enough, this is like a cosmetic news update. I was fortunate enough to be able to be invited, as I said, as a past president of the California Academy of Cosmetic Surgery to speak there, and gave 3 lectures. What I'd like to do maybe over the next few shows is kind of give you some cosmetic news update as to what I learned. I always find that when I go to a conference that although I'm supposed to be bringing my expertise and educating people, that I actually walk away with learning much more than what I think I bring to a conference. So that's always wonderful. So why don't we start right now with what I learned at the California Academy Cosmetic Annual Surgery meeting down in San Diego, the 26th for November of 2024. So one of the first lecturers that I listened to was a Dr. Hayes Gladstone. He is now actually, I told you I was the past president. Dr. Hayes Gladstone is the present president of the California Academy of Cosmetic Surgery, and he talked about anatomy of the face. So why am I talking about that on KSRO today? Well, the whole aim or goal of his lecture was talking about anatomy to these injectors, and they could be surgeons, non-surgeon aesthetic physicians, nurses, physician assistants, and so forth. It was solely based on safety. Okay, so it's really important when we do anything invasive that we know that we are treating the patient like we would want to be treated. So in my opinion, in total agreement with Dr. Gladstone, is that you want to go to somebody who feels passionate about what they do. Of course you do. All right. Secondly, though, you want to know you are going to somewhere where the injector, who might be doing Botox or filler and so forth, really is a perpetual student, okay? The person that really, I'd like to talk about the positive aspects of things, but I'll go negative for a second. The person who's most dangerous is the person who doesn't know what they don't know. Okay, the person who's most dangerous is the person who doesn't know what they don't know. So that's the beauty of my being able to go to these meetings where I meet with my colleagues. I learn from doctors, nurses, from everybody that's there. I actually bring my surgical team down and my medical team down with me. So we're actually down in San Diego, and of course we're having fun going out for dinner and enjoying the sights and so forth. But we actually are in the lecture hall all day, and we are listening to these various lectures, even if it's something that we don't particularly offer. And because we're there and we're taking in this information, it makes us better physicians and nurses and medical assistants. So you want to go somewhere, if you don't live nearby, you want to go somewhere else, make sure whoever you pick that they feel passionate and that they're the perpetual student. That's huge. Dr. Hayes talked about the anatomy. I'm not going to go into specifics of the anatomy here on our radio show here on KSRO, but he did talk in particular about blood vessels and nerves, and those are areas that we would like to avoid. So one of the key aspects that Dr. Gladstone talked about, besides the actual anatomy, was something that we call surface anatomy. So obviously we're not a picture when we look at a patient. We're not looking at the muscles and the fat and so forth. We're looking at their skin, or what is their surface anatomy? What are the certain markers that we find that we will know where these particular blood vessels are? And because the biggest thing that we want to avoid is injecting into a blood vessel. It's called an INTRA, vascular injection, and that can lead to blockage of arteries and even loss of our own body tissue. So that's something we really want to avoid, and knock on wood for me, I've been very fortunate that I've not had that be an issue for any of my patients. Nonetheless, it's something, being a perpetual student, being a physician who in the past as a general vascular transplant surgeon know that anything that we do is a big deal for the patient and that we need to treat it with great respect. And I always tell our staff that our behavior should be basically governed by the principle of what would we want the staff to do if we were the patient. Okay, so that's really important. And I think you can get a sense of that wherever you go. Is do they look at you as a person? Are they careful? Are they carrying on with their little things that they do, cleansing the skin, how they prepare things for you, educating you? Are they doing it to give you the best outcome and to be safe for you? I remember there was once a comedian who was really cute, and I remember him saying that his question that he posed to the audience was, what's the definition of a minor operation? What's the definition of a minor operation? Do you know what it is, Jeff?
I do not.
Okay, when it's on someone else. Okay, so that's the definition of a minor operation. So anything we have done on us is a big deal, and you want your injector, your doctor, your nurse to show that kind of respect for you and the human body. So Dr. Gladstone gave a very nice talk. He's a facial plastic surgeon here in the Bay Area, and he gave a very nice talk about anatomy, and a few caveats that he gave was talking about and now I'm going to move on from, or I'm going to specialize when we talk about injections, injecting fillers. So that's things such as Restylane, Juvederm, and so forth, filler, hyaluronic gels. And he talked about using needles, and he also talked about using what we call cannulas. Cannulas look like a long needle, but they're blunt on the end, so they're not sharp. And they have the theoretic and potential to cause less bruising because they're blunt, and so they shouldn't cut a vessel, and also the potential to decrease the potential for an intravascular injection or injection of filler into the blood vessel. And so, that's somewhat controversial because we can't necessarily pull up a scientific study that shows 100 people injected with a needle, 100 people injected with a cannula, and showing a statistically significant improvement with that. But most injectors, most surgeons like myself, feel that a cannula in some areas can be definitely a safer alternative. So I tend to use, I'm going to say cannulas about 80% of the time, and then I use needles about 20% of the time. And if you have questions about that, you can always ask your injector. But I like to use cannulas in the cheek area to plump up the cheek, in the temple area and in the eyebrow area. It works very, very nicely. When I'm injecting in different folds and so forth, a lot of times I'll use needles or in the lips because it's a little bit easier on the patient and it's a little bit more accurate. But again, you just have to approach that area with a lot of respect. So that was Dr. Hayes Gladstone, who talked about anatomy, but with the sole purpose of safety. And that was very illuminating, and I know that our staff also enjoyed listening to Dr. Gladstone. So that was wonderful.